Hey, Corporal Sean here with Dr. Stacey Clarke, and we just wanted to put together a quick video for you on the 3 most recommended exercise for core strength and stability. Now, these aren't your main six-pack building exercises. These are more for either rehabilitation of back injury or just preventative for back injury. And these come actually from Dr. Stu McGill of Waterloo University. So the 3 exercises I'm going to show you. The first one is going to be the single leg bent knee crunch. So one's going to be on the ground. So I'm going to use Dr. Clarke here, and I'll get her to just slide down sort of sideways like this. So she's on her back here, and I'll get you just scoot this way a bit so you can see it. Now with this, what we want to do is we just want to bend one leg. So I'm going to have her bend one leg, and what this does is it sets up the back and it keeps her neutral. Just relax down. It takes pressure off her hip flexors, so it's going to keep her pelvis quite neutral while also keeping that normal lumbar curve in her low back. She's going to take their hands down, and she bends at the elbows, just putting the end of her fingertips in behind her low back. This is going to help her maintain that neutral curve. Now, she's not holding it up, she's just finding that pressure point so she knows when the pelvis starts to rotate back. The other leg stays neutral, and what she's going to do from this point is just a small crunch, and the crunch is going to shorten the distance between her rib cage and her pelvis. She's going to lead from her sternum, her chest bone, versus through the chin. So she's just going to come up, nice slow hold, controlled, breathe out, and she's going to go back down, just to the point where her shoulder blades touch the ground, not releasing full tension, but just that little bit of tension before she comes up again. Now here the recommendation is doing between 8 to 12 repetitions, taking a break, and then doing 1 to 2 more sets. So a total of 2 to 3 sets all together. And she would switch legs in between the different sets. So notice she's leading from the sternum. The most common faults in this exercise is going to be leading from the chin, and if you watch, the chin is pulling up here, so she's stressing the superficial neck muscles or cervical muscles, and this can cause some neck strain and some discomfort. So to aid and assist that, we remind them to lead from the sternum, and at the same time you can incorporate some of the deep neck flexors by using a pressure of your tongue up against the roof of your mouth in behind the back of the front teeth, and that's going to take some of the stress off those superficial muscles to allow it to work through the front core here. The next exercise that we're going to do is what's known as the side plank. Now the side plank here, again, we're looking at endurance and stability. So what I'm going to have Dr. Clarke do is go onto her left side down. Now we're going to work this in progression. The first she's going to do is from the knees. So she's going to bend the legs as she has here. Pressure point is from the knee to the elbow. She's going to stack this shoulder just above her elbow, and she's going to lift the hips up. And her intent here is to create a straight line from shoulder to hip to knee, even on the down side. If she's curious to see what muscles are working, she can take her top hand and just reach it underneath the stomach here to feel those muscles active. Otherwise, the top hand can be used to point straight at the sky, can point straight down along the body, or it can reach onto her downside shoulder to provide a little bit of security and support. So she can grab right onto the shoulder area here and hold in, and that gives her just a little bit of comfort if she does have any previous shoulder issues. She's going to hold this position here, and again, you're looking at about a 10-second hold. She would then switch to the opposite side, or take a short break before hitting this side 2 to 3 more times. Now, progression of this exercise, and we're going to take her, back up to that point there, is I'm just going to have her raise her top leg up. So again, she's going to bridge up. All I want her to do is lift that top leg. This is now going to cause a little bit more challenge to her downside core. Again, it's a stability exercise. We're also now focusing on the outside of the upper leg into the low glute region or the medial glutes, as well as the upside of the top leg. So this is her secondary progression. Again, challenging harder from this would then go to a full body side plank. So she's straightening the legs now. Again, we're looking for that straight line, shoulder, hip, knee, and ankle, all the way down and through. Top arm is just resting, can be on the opposite shoulder for support, and point towards the sky. Final phase of this to make it most challenging is to raise that top leg up. And again, here the most dynamic now because we have her challenge. She's balancing, keeping the top leg up, while also exerting force to keep her low side stable and straight through the spine. So we're going to rest on that one. That's the second one. Remember, the first was that small crunch, the second one being the side plank. The final one is known as the bird dog. And the bird dog, again, we're going to go through the progressions here. We're looking at anti-rotation of the spine. So we'll have Dr. Clarke on hands and knees. She's stacking her shoulders just over top of her hands, her hips just over top of her knees. Now this is the important part here because we want to set up that 4-point base of support. Progressing here, what she's going to do is she's going to make sure her core is tight by pulling her belly button in towards the spine, almost like there's a helium balloon attached to the back of the belly button, pulling up through the back of the spine. She stays strong through here. Gaze is neutral, either at the ground or just forward. Progression of this is going to be the single appendage or single arm or leg. So first we'll start with the upper arm. We'll go 1 time through, and then we'll make it more dynamic. She's going to take her left arm, pointed up at the 11 o'clock with thumb towards the sky, and she's going to hold. Now the important point thing here, again, remember, is anti-rotation. So we'll get you to come back to that rest position of hands and knees. The neutral spot here is where we want to maintain it. We'll demonstrate this more when we get to the leg. So we'll show that arm up. The arm comes up, thumb towards the sky, holding for a period of 8 to 10 seconds. before relaxing down, catching her breath, and then moving on to the next arm. Coming over to the right side again, now she's at the 1 o'clock, thumb is up in the sky. Thumb is up importance because we're looking at external rotation development of the rotator cuff complex here. The arm comes back down, as well as stabilizing through the low lat muscles and low serratus. Now the important part here when we go down to the legs, more challenging. You want to make sure, and we'll show you the common faults. So I'm going to get Dr. Clarke to raise her right leg up and point it straight back. She's looking at the 5 o'clock, and you can see that she's done it absolutely perfect. She's not shifted her weight. So she's still balanced where she was. It's almost if her leg was still touching the ground. She hasn't moved her hips over. She's also not hiked this top side hip up. I'll get her to bring the right leg down now. And what I want you to watch on this one is she's going to do the incorrect version. She's going to point the left leg back, but I want you to see as her weight shifts over this supporting leg, and this is how we don't want to do this exercise. So the leg comes up, and you'll notice a shift of weight and also a hiking of the hip. So she's putting all her weight down and through that leg. Now the challenge of this exercise is to remain absolutely neutral where she was. So that leg, let's bring it right back down. And if you're guiding someone on this exercise, you can just put a hand towards either side, have them lift that leg, and they'll know if they're putting a little bit more pressure towards your hand as they start to shift their weight. You can guide them back towards the center. And as her leg comes back down, now this might be the level that you're at, which is totally great. Again, working at single arms and legs. If you want to progress to more of an advanced version, you would go the combined opposite arm and leg. So in this case here, we'll go left arm, right leg, and watch here the non-displacement of where her body weight is. She's absolutely square, lifting that left arm, right leg, and nothing is moved whatsoever. She's still square up, the hips aren't hiked. She's holding, gaze is neutral. Again, you're looking for an 8 to 10 second hold before bringing the arm and leg down, relaxing, breathing, and then shifting over towards the opposite side, going with the right arm at the 1 o'clock, left leg at the 7 o'clock, toes pointed as long as she can be, abs in and through tight, 8 to 10 seconds, relaxing down and hold. So again, thanks so much, Dr. Clarke. These are the 3 main exercises recommended by Dr. Stu McGill from Waterloo University, and these are exercises you can do. One, if you're going to, or you're looking to rehab back conditions, an unstable back, maybe you've got some back pain. Again, these are obviously going to be guided and dictated by your medical practitioner, whether chiropractor or medical doctors. Certainly check with them first. But from what we've shown and what we've read and understood through the research is that they can use to strengthen a core that's currently undergoing some sort of a back issue, as well as they can be used preventative. So doing these 3 exercises every single day is not a problem. To do them and to ensure that we have that strong core so it's there when we need it, so we're not dealing with any sort of potential back issues or back injuries from small things like picking up groceries and picking up a child or maybe shoveling in the winter time. Anything from you, Dr. Clarke?
I think you said it all.
Good to go. Thanks so much for checking this out.